plastic from biohazard bags used in operating rooms create this bubble. The surgical team at Mercy Hospital St. Louis create a bubble environment for high-risk COVID-19 surgeries, and they practice in this Mercy simulation lab.
Test out different techniques, test out different materials for this process.
Finding ways to keep everyone safe during a pandemic takes innovation, creativity, and quick thinking.
We had to think outside the box for a procedure that we routinely do on patients all the time. We have extrapolated a technique used to intubate patients with highly contagious COVID virus using a plexiglass intubation box or a TARP technique to cover the patient when intubating. We've extrapolated that to the tracheostomy procedure itself, which is also known to be a very dangerous procedure in terms of transmission of the COVID virus.
They use ordinary materials available in the hospital. This new operating bubble allows surgeons to perform an open tracheostomy on the sickest COVID-19 patients without having to move them to the operating room.
We essentially bring the OR up to the intensive care unit, always to do it in their room with COVID, since they're already in a negative pressure room, to minimize the travel and risk associated with the travel.
Tracheostomy surgeries are high risk for healthcare workers because of the aerosolization that occurs when a breathing tube is inserted into the windpipe.
Cutting a hole in the neck into the windpipe to change a breathing tube from an oral tube to a neck tube and decrease the resistance of breathing, decrease the work of breathing to help assist a patient get off a ventilator. Certainly a very highly aerosolizing procedure, very high risk procedure.
The surgery becomes necessary when a very sick COVID-19 patient spends prolonged time on a ventilator. It protects their vocal cords and makes it safer to wean them from breathing support when their condition improves.
So we finally had some patients who were eligible for the procedure because they had survived long enough with an oral tube in place to become candidates for the procedure. We wanted to scale it down and have it be the most efficient procedure we could do, limiting the exposure to all personnel and the patient, and perform the procedure entirely within this bubble.
They hope their innovation might lead others to come up with a more permanent solution.
We feel like this is a technique we want to get out as soon as possible so that others can benefit and hone the technique further.